The topic for today, or today's talk, is about inclusion and exclusion in national digital ID programs. I can see that many of you do work in, or are related somehow in digital ID work. And if you've noticed, many of the policy papers, for example, the World Bank Principles and many other papers call for, elimination of exclusion and inclusion of everybody in the digital IDs that are being issued by countries. And so the question becomes, what does this exclusion mean? What is it masking when we just use the word exclusion or inclusion? So this is the topic for today's discussion. And I'm going to call upon the director of CIPIT, Dr. Isaac Rutenberg, to start by making some welcoming remarks. And right after which I'll call upon Melissa to take us through the discussion. So welcome, Dr. Rutenberg.
Thank you very much. It's great to see you all here. Some very well-known names in the digital ID space, and also some new people for me, some I'd like to get to know. So it's great to see you all here, and we're really pleased to be having this conversation today, which is the culmination of almost 2 years of engagement with our colleagues over in West Africa and Ghana. So we're really super happy to be doing this. I will be very, very brief. I only want to plug, as I promised Grace, I would plug our general ID work, or the work that we do in general, which is screen sharing now. This is our webpage. This is our homepage on digital ID. And you can see we've got quite a number of resources. I hope you will explore those later. And I hope that they'll be helpful to you. Probably our most, not most, the one that, well, at least that I took the most effort on was this one, categorizing risks and harms. I did this with Abdul, one of our research assistants last year, and it basically takes work that was done with our collaborators in India at CIS and expands on that. We all know that there are a lot of risks to digital ID that's not implemented well, but those risks are kind of vaguely stated. This could happen, that could happen. So we went a step further on that and explored what risks are actually happening, or what of those risks are actually being felt by people, and what are the impacts of those risks. So we were able to categorize all of the different risks into 3 categories, and you can read about those on the report on the website. We also have a bunch of use cases on COVID and non-COVID uses of COVID and non-COVID related uses of digital identity. Those are explored in our on these 2 pages here. We have a Kenyan ID paper that is in under peer review currently, which explores the history. It explores Huduma number from a historical perspective. And it's really pretty incredible to see how history repeats itself in the use of digital ID. So that's when that paper is available, we'll be making it widely available. Copyright permissions, assuming those are there. But for now, you can read the summary here. Now, the inclusiveness and exclusiveness of ID in West Africa is why we're here today. And so with that, I will stop screen sharing, and I will just say welcome to everybody. Thank you so much for being here. And I look forward to a really engaging conversation. So Grace, back to you.
Thank you, Isaac. Let me now pass the mic to Melissa to take us through this session. Melissa, please take it away.
Thank you so much, Grace. And thank you to all our participants who are here today. My work as the moderator will be to introduce the panel to you and then hopefully facilitate a very engaging conversation on the report that we'll be highlighting today. Our panel is made up of 3 experts from 2 regions in Africa, and between them, they do have a wealth of experience and knowledge. So let me get right into it. First on our panel, we have Dorothy Mukasa. Dorothy is a team leader at United Witness Uganda, a leading charity organization working at the intersection of technology and human rights. She has spearheaded the demand for public scrutiny within the designing and implementation of digital ID systems in the country through research and policy advocacy. Thank you so much for joining us today, Dorothy. Next on our panel. Thank you, Dorothy.
Just a correction, it's unwanted witness.
Unwanted witness, yes.
Good.
Unwanted witness, Uganda.
Good.
Next on our panel, we have Yusuf Bashir. Yusuf is the Executive Director and founder of Haki na Sheria Initiative. He's an advocate of the High Court of Kenya with extensive experience in successfully litigating public interest litigation cases, including the Huduma number case, where he served as lead counsel for the Nubian community. Yusuf has spent his career working with various local and international NGOs, fighting to end discrimination and various human rights violations of minorities and marginalized communities in Kenya. Yusuf has a master's degree in law from the Queen Mary University of London and is a graduate of the University of Nairobi and the Kenya School of Law. He's also a previous recipient of the Chevening Scholarship. Thank you so much for joining the panel today, Yusuf. And finally, we have Teki Akwete Falconer. Teki Akwete Falconer is an ICT telecom lawyer, a privacy and data protection consultant, and senior partner at a law firm based in Accra, Ghana. She's also the founder and executive director of the Africa Digital Rights Hub, a member of the UN Global Pulse Privacy Advisory Group, and a non-resident fellow of the Center for Global Development. Previously, Teki has worked for the government of Ghana in the development of several key legislations in the ICT sector, including the Data Protection Act of 2012, the Electronic Communications Act of 2018, and the Electronic Transactions Act, also of 2012. She was also the first executive director of the Data Protection Commission of Ghana, and she holds an LLM in Information Technology and Telecommunications Law from the University of Strathclyde, Glasgow, Scotland. Thank you so much for joining us today, Teki.
Thank you.
Teki is one of the authors of the report, which was done by the Africa Digital Rights Hub. And the title of this report is the inclusiveness or exclusiveness of national IDs in West African countries or focus, which are Cote d'Ivoire, Ghana, and Nigeria. And she's going to present to us the key findings from this report, which is what we'll base our discussion on here today. So without much further ado, over to you, Teki, for the presentation of your report.
Thank you. Oh my, thank you very much. And apologies in advance. I have people moving around my house. So in case you hear some dogs making noise, I hope you can hear me clearly though. Yes, so we'll try to make it snappy. Thank you to CIPIT for this opportunity. We had a very, very interesting experience working on this project, and we did it with a few other people. Just gonna try as much as possible to share my screen now. Just give me a minute. Okay, I think. Okay, can you see my screen?
You have started sharing, and yes, we can see your screen now,
Okay,
Teki.
great. So we did the study, as has already been mentioned, on the inclusive and exclusive use of IDs within West Africa. Before I start, I just want to acknowledge, just give me a minute, I'm trying to move this around. Yeah. Okay, good. So I just want to acknowledge a few of the colleagues I work with. Mr. Smith Odru, who is a PhD candidate with the Political Science Department at the University of Victoria in British Columbia, Canada. Mr. Boris Pacom Hufwe, who's a lawyer in Cote d'Ivoire, and then Mr. Serge Patrick, who's also a consultant we worked with in Cote d'Ivoire. We wish to just express our gratitude to Strathmore University in Kenya, also for supporting this work. Now, we focused on 3 main countries, as you already know by now, and these were Cote d'Ivoire, Ghana, and Nigeria. The countries were identified to represent the diversity of the legal systems and the governance structures within the West African community as well. So we had the Francophone, the civil registration systems, as well as the common law legal systems as well. And we looked at 2 main IDs. And these IDs we chose as a result of how they impact the issues of inclusion and exclusion, which I will discuss briefly. So we focused on what is usually known within these countries as a national ID card or a national identification number in some cases, and then the national health insurance. Our objective was to look at both what is known within these countries as foundational IDs, which are IDs that you need to be able to access other IDs, and then functional IDs, which are nationally related IDs that provide a particular service or is used to access a particular function. So these were the main areas. As I earlier mentioned, the purpose of the project was to review the use of IDs within the 3 West African countries in order to determine where it has been used to include or exclude individuals. In doing so, we reviewed relevant literature, we reviewed laws and policies, we also looked at gray literature, primary and secondary accounts, and other materials on inclusive and exclusive use of IDs in the respective countries. And in defining what inclusion and exclusion meant, we drew our report from the World Bank's Identification for Development Program, which emphasizes universal coverage and accessibility. And so we defined our inclusion and exclusion within this context. So for us, inclusion as relates to ID systems can be attained by ensuring universal coverage for individuals from birth to death, free from discrimination, and then removing barriers to access and usage and disparities in the availability of the information and the technology. So the first things we were looking at when we spoke about inclusion was coverage of these cards, from access to them from birth to death, whether there were some discriminatory factors inherent in them or not. We also looked at barriers to access it. How do you go about it? Barriers to using them and any other disparities that were available. What we did was that we assessed inclusiveness by analyzing laws as well as practices relating to enrollment and use associated with each ID system in the respective countries. We also sought to understand how the determinants permit or deny certain persons from accessing an ID, and invariably public and private goods tied to the production of these IDs. We were guided by these questions. Who can access an ID by law? What can hinder qualified persons from, and also what can hinder qualified persons from accessing and using ID cards? We made the following observations, and I've divided them into positive and negative observations. We noticed that most of the laws and policies around IDs within these three countries, especially looking at the IDs, we looked at the national IDs, and then the health, the equivalent of the health insurance, the health insurance cards in the respective countries, were pro-inclusive. So most of the laws, if you just look at the laws, you would see that these laws were very inclusive. So there were definitions like this, these things is accessible to everybody, or every citizen is allowed to have access to it. We also noted that there were some administrative, I think this should have come into the negatives. I'm sorry it is here, it shouldn't be. But we also noticed that a good number of the IDs can be accessed, except for a few countries, can be accessed at no charge to the citizen, which also makes it accessible. Then we also noticed that there were efforts by the government agencies to ensure that most of these IDs are accessible, and by saying that, we were looking at how they were, enrolling participants, where people can go to access these IDs. We also noticed that most of these governments were putting in place a lot of structures to enable that. We also noticed that documented immigrants were also given access to IDs generally in all the countries we looked at. And there was some flexibility around the proof of citizenship required for enrollment. We'll talk a bit more about this. On the negatives, even though we noticed that some of the laws and policies and practices end up promoting exclusion of certain groups. So, for instance, in Côte d'Ivoire, we noticed that a number of changes to the laws, even though the law was accessible, says that all citizens, there were some communities within Côte d'Ivoire that did not necessarily have certain IDs, and they were termed as foreigners by the definitions provided within those laws. And so for those people, even though a lot of these people have been born and have lived all their lives within Côte d'Ivoire, they were unable to access the IDs. And in fact, it was an eye-opening observation to make that this had been some of the bane behind a number of the unrests that had happened in Côte d'Ivoire over the last 10 years in terms of who is a citizen and who is not. We also noticed that even though the IDs were pro-inclusive and most of them could be accessed at no charge to the citizen, there were high transactional costs associated with accessing these IDs. What were the nature of these high transactional costs? Usually, it looked at when and how to access an enrollment center. So some of the enrollment centers were not within accessible range, especially for the poor and vulnerable within some of the societies. So they have to travel, which meant car and other costs to be able to be enrolled. For some of the people as well, enrollments were digitized. And so in places where it was digitized, they need to access some form of technology platform, usually at a cost, to enable them enroll as well. There were also, transactional costs relating to people going to centers of enrollment, and and then the ID systems that are being used to enroll have broken down. So it means they have to go back and come back at another time. People do the enrollment, have to go and come back another day or at different times for the IDs. All these, went into cost. In some cases, some people were not able to ever go back to access their IDs. While the digital platforms also promoted access, as I mentioned earlier, it also marginalized persons who did not have direct and easy access to these digital platforms. We also noted that whilst there was access was given to documented immigrants, some of them had to pay very, very, very high fees, which was almost detrimental to accessing it. And within the West African region, where we had this free movement of ECOWAS citizens within the country, we realized that the high fees charged for documented immigrants really minimized and made it impossible for especially West African immigrants within these countries to be able to access the IDs, because the cost was extremely high. So that also led to, we also noticed that there were situations where undocumented immigrants were excluded, which also minimized their access to IDs, and for that matter, services that were offered. We made the following, we noticed the following key lessons: that providing state-issued IDs at no cost is a good way to expand access to ID systems. We also noted that a key lesson that we learned was that increasing enrollment centers is a sure way to use proximity to encourage the target population to register for ID credentials. We also noted that increasing the use of digital enrollment platforms boosts access and speed of enrollment. However, an alternative option must be considered, for those who do not necessarily have access to these platforms. We also noted that where immigrants are required to pay to access IDs that are otherwise free for citizens, it may be necessary to consider immigrants who may not be necessarily in a strong economic position. So within the case of West Africa, we thought that maybe we need to look at it and review rates for possibly West African countries that have documented immigrants within the respective countries. The exclusionary dimensions of ID systems in West Africa are not only about whether citizens can access state-issued ID credentials. We also noted that this was a key lesson we learned, that the issues of exclusion was not a mere fact of, citizens having access or immigrants having access to the IDs, but that inclusion and exclusion issues were also about whether the bearers of these credentials can use the cards to access public and private goods in the first place. Because some of the observations we made was that even in situations where people have these IDs, it was still extremely difficult or almost impossible to access services that they have signed up for, especially when it came to the health insurance. Some people had to pay certain fees for health insurance, which in itself deterred them from using the cards. And, you know, one of the key lessons we learned was that states must ensure that citizens can access critical public goods and services in a timely and satisfying and a non-discriminatory nature. So in all, these were the recommendations that we made, that the move towards making all ID cards and or identification numbers mandatory, you know, before accessing public and private services must be tamed with alternative arrangements for persons who do not necessarily possess or cannot access such credentials. Because we noticed that, in fact, Nigeria was one of the very open countries that was allowing as many credentials to be able to access these IDs as possible. But also we noticed that there's a downside to that as well. For instance, they were even accepting privately issued IDs to enable people access national IDs and numbers. But the challenge there is also the integrity of some of these privately issued IDs. But what we are saying in all is that any government that is issuing or looking at enrolling people for national IDs, where these IDs must be mandatory, must explore measures or a balanced measure that allows even people who do not necessarily have access to some of the foundational documents that they require to be able to have some alternative means that is easily accessible. In Ghana, for instance, if individuals did not have access to the required documents, they could present guarantors that were able to assure and provide some sort of assurance to the ID issuer that these individuals are within the communities and they are Ghanaians and all that. So we thought that some of these measures must be looked at in, you know, enabling people that have otherwise been ostracized because they do not have access to some of these documents to have access to that. We also recommended that efforts must be made at reducing the high transactional costs caused by delays of issuing the IDs, few registration centers, dysfunctional registration machines, corruption and lackadaisical attitude towards by enrollment officers towards as citizens or individuals that are trying to enroll. We also recommended that digital registration must be supplemented with an offline enrollment mechanism that supports individuals that may not necessarily have access to the or have access or to be enabled to be able to facilitate the digital registration process. Sorry, we also recommended that it is important to not use relatively high access charges to undermine the inclusion of immigrants, particularly persons from within countries of similar economic standing within the countries that we looked at. And then we also recommended that documentation required as proof of one's eligibility to register for an ID must be thoroughly considered. And by here, we want to look at, okay, what kind of documents are easily accessible? What kind of documents and information can be authenticated, you know, to make sure that you are not just registering anybody, but you're capturing the right information into these ID systems. And last but not the least, we recommended that it is important that in the pursuit of an inclusive ID regime, we try as much as possible to tie it to inclusive access to critical public and private goods and services. So, you know, if we're issuing health insurance cards, for instance, we must make sure that, you know, these insurance cards provide or enable access to the goods and services that they are tied to. And so that is where I will end it and come back to you for any inputs or questions. Yeah, thank you.
Thank you so much, Teki, for highlighting the report for us. This is a very important report. And for me, the three things that come out is, number one, that you did determine that most of the laws dealing with the national ID, it is 3 West African countries, have a pro-inclusivity disposition. And usually where the failings come in terms of exclusivity, would be in implementation with such things as administrative policies that then come in. And that was really interesting for me to note, because I would like to hear from Yusuf and Dorothy if the same is happening in East Africa, especially within Kenya. I know Yusuf has a wealth of information where we'll talk about, for example, double registered persons and who those people are in Kenya. Yusuf?
Thank you, Melissa. I think the report is very interesting, and some of the points that Teki has raised were provoking a lot of thoughts in my mind. With regard to laws that make that tend to include or exclude, you will find that in Kenya the constitution is regarded as a broadly progressive document that has provisions on issues of discrimination along especially ethnic lines, that people should not be discriminated based on their ethnicity. However, the history of the country is such that for the longest period, discrimination has been at the core of the ID system and the ID process. Whereby the ID is a system, ID issuance is a process of identifying who should not access government services and who should not be recognized as essentially a Kenyan. And ethnicity was, since colonial times, the easiest tool that governments have used. And since independence, because of issues of ethnic competition, you'll find that a lot of minority communities that have less strength when it comes to voting tend to be the ones that suffer discrimination. On the specific issue that you've asked me on double registration, you'll find that poverty and discrimination and marginalization has resulted in individuals went in the 1990s and continuously since then to register themselves as refugees, but without understanding the impact that would have. And these individuals who registered themselves as refugees ended up becoming essentially stateless, because the Kenyan government would not issue them with nationality documents afterwards, and therefore they have had to struggle since that time to gain access to these documents and subsequently government services. A point that was mentioned by Teki about the difference between legal, for example, laws that tend to include and administrative hurdles that are set up. For example, you'll find that vetting in Kenya, which is an administrative procedure that the Kenyan government uses before issuing certain people of certain ethnic groups, such as the Nubians, such as the Somalis, with an ID, and this doesn't apply to people of other ethnic groups, you'll find for the longest time was an administrative, did not have any legal anchor. And it's only after a couple of security incidents such as terrorist attacks, that security laws were passed that sort of put them in that in a legal framework, which is still not very clear, but generally recognizes that registration officers have the right to have discretion when it comes to these processes. So I would say for now that would be my comment, and I'm happy to say anything further, Melissa.
Okay. Thanks, Yusuf. You've said a lot that we definitely need to engage in, but I want to bring Dorothy into the conversation and so that she can tell us what the position is in Uganda. Would you say that in Uganda that the national ID laws are pro-inclusive in disposition?
Thank you, Melissa. Thanks, Teki, for the presentation, good research, and my colleague panelist, fellow panelist Yusuf, for bringing in the Kenyan perspective. Yeah, Melissa, the issue of the legal framework in Uganda, brings in a lot of debate in terms of how the laws really come into force. For example, speaking about the constitution, is the most progressive, just like the Kenyan is very progressive when it comes to upholding the dignity and rights of individuals. For example, it's very pronounced on the issue of non-discrimination, right? And therefore it should be the basis of all the other laws that come into play, because it's very clear in the constitution that any law that comes up and contravenes the constitution should be null and void. But we've continuously seen laws that come into force and very contradicting the constitution, and they still stand. The case in point is the law of registration, the Registration of Persons Act. Yeah, it's both inclusive and exclusive in nature. For instance, it's inclusive in the way that it provides free access to a national ID system. Everybody registers at no cost. But then when it comes to the replacement, but also the technicalities of the difference, the institution that's supposed to provide the ID, man the ID system, it's so centralized that it leaves out the poor, who are the rural communities, but also the poor in the urban areas who cannot access the cost of transport to and from that system. But also the system is clogged with corruption, which means the poor cannot meet the expenses of acquiring a national ID. But on the other hand, when you look at the replacement of a national ID, for instance, if one loses a national ID, that's supposed to really, person is supposed to pay a cost. There's a cost for a replacement. Not so many Ugandans can afford to pay for that replacement. But also on the issue of accountability, because it's very important for people to be able to be included in the system. Accountability on the part of the implementing agency is really very, very low. It places a lot of accountability on the user rather than the implementing agencies. For instance, there's so many individuals who have errors on their IDs, these errors really mean that somebody will not be able to access a service simply because the ID has lots of errors. There are multiple errors, hundreds of thousands of Ugandans are excluded because someone somewhere in the agency could not do their work right. But then the law does not press any accountability mechanisms for such errors, and this goes to people who are supposed to access, the older persons who are supposed to access the social protection fund, for instance, errors in terms of their age, errors in terms of their names, errors in terms of their localities. All these play out at the end of factor in the process as somebody tries to access a particular service. So accountability is very, very important, okay, when it comes to inclusivity. And another issue is transparency. For any system to be inclusive, there has to be transparency in terms of design, you know, and also implementation. Because today the system is based on biometrics. Many people cannot, for example, for the Africans who do a lot of manual labor work, you know, when it comes to capturing of these biometric features, it becomes a problem, okay? And then somebody cannot be captured into the system without going through the biometric system. It can't be bypassed. So there are so many people who are left out, excluded, just because either their thumbprints are not readable, or their faces cannot be captured by the system. And this goes to so many laborers in this part of the country that are doing work and have had their thumbprints wither because of the kind of work that they do. All these are factors that are not really considered within the legal framework, but they're really experienced as people, as implementation and rolling out of the system is being undertaken. Thank you.
Thank you so much, Dorothy. Definitely highlighted a lot of points that need better thinking, other than just having a proper, or what we call an inclusive law. The actual experiences that are out there, as highlighted from Yusuf and Dorothy, and as well as in the report, is that saying that something is inclusive and actually experiencing it as inclusive are two different things. One key area surrounding all these things is the question of access. And Yusuf has highlighted that when he talked about the double registration and how that came about within the Kenyan space. And Dorothy has highlighted the issue of accountability in terms of access seems to be there on in the works on the paper, but there's no accountability, for example, for errors, and that's not contemplated by the law. So bringing us back to the issue of access and look at the history of some of the injustices that are occurring in the question of access, then and trying to tie it together with digital ID, which is based on our national ID system. Can we really say then that digital ID will cure the problems that have not been addressed in our normal national ID system? Is digital ID going to be the answer to these questions? Will it help with accountability that Dorothy is talking about? Will it do away with the double registration, or at least help to find a solution for the double registration that Yusuf has talked about? Or are we just building castles in the air? And this is for everybody on the panel, but I'd like Teki to take it first because we haven't heard you speak. And I have noted the questions in the chat and we'll get back to them in a minute.
Yes, so your question is whether digital IDs will cure the issues of what I will call quality of information and access. From what we did, you have to be very deliberate when you're looking at access. And clearly as you have clearly identified, and you can see throughout the report, putting up a digital platform does not necessarily cure the mischief. And so if access is the problem, then we need to look at what is really preventing this access. It's not the matter of having digital platforms. That is not the issue about access. The issue about access goes to, first of all, at the very basics, right? Do I have the rudimentary documentation required to be able to have access to an ID? Most of the countries have a very, very defective birth registration system. that is not working efficiently. So children that are even born, or even if you go back 10, 20 years, there are a lot of people, especially the vulnerable, who do not have birth certificates or any other means of, having the foundational document that is required. That's one of the first challenges to access. So you may have rightly been born, you may have been a citizen, but you're being excluded just because, or you are unable to access the ID just because you do not have available the foundational documentation. And this issue will be there whether or not we're using biometric systems, because we still need these, call them access documentation, to be able to have and provide access of these biometric IDs to anybody that needs them. The second issue about access is also making it possible, if I have my documentation and information that is required, is it within my reach to be able to access such a platform? And this is irrespective of whether it's biometric or whether it's a physical registration system or a mix of both, right? Can I go into a center and have access to it? What we found was that a lot of the places that do not have a lot of enrollment centers minimize being able to access. An example, for instance, in Ghana, the mass registration that started, for instance, for the national IDs, moved around. They were moving around from communities to community. So if they end up in your community at the day that you are not available, essentially you've been left out, until they come back to do a mop-up exercise, which God knows, nobody really knows exactly when that will happen. So that's also another thing. Then we have the long queues. It takes some people days, to register and to be verified. Then they have to go up and come back and take a documentation. We had a personal experience of speaking to somebody, for instance, who registered, and even the enrollment procedure. So remember, a lot of these people are not necessarily the people keying in their information, right? And making the input. So the basic information, some fill it on a piece of paper, hand it over to an enrollment officer, who, if probably has tens or maybe about 20 or 30 people on him, and he has to key in everybody's information. In the process, mistakes are made. I have situations where people had their IDs issued and there were mistakes in the name, so in certain key aspects. So they have not been able to use, and in this case, this was a health insurance card. They have not been able to use it because the documentation there does not match up with any of their relevant things, bank accounts, or any, because there's a mistake in the name. And just to correct that thing, there's no accessible, straightforward procedure to say, oh, there's a mistake, come to this point, and sometimes the enrollment place is very different from where they have to go and do the correction, because the enrollment center is not a permanent center. One of the countries that we found was doing an amazing job was Cote d'Ivoire, where they were putting a lot of effort in creating a number of enrollment centers. And they had even, gone beyond that to look at using community leaders and all of that to facilitate enrollment and all that. So the issues of access, for me, it's not about the technology. What's the mischief we're trying to address, right? If these are the challenges, if people are not knowledgeable enough to use the electronic systems, what measures are we providing that will enable them easily access it? If it's taking too much time, for which reason they are not coming forward to access these IDs, even if it's free and it's costing them much more, are we looking at the mechanisms that limit such access to enable them have it? And I think that if we ask those kind of questions and we try to solve the issues from that perspective, we will realize that sometimes even the technology may be good, but it is not the answer to our problems.
Thanks, Becky, for tackling that head on. I really enjoyed that answer. Yusuf, do you have anything to add on that about how digital ID, especially within Kenya, has been lauded as the answer to all our problems with our registration? Once we have Huduma number running, everything will be perfect.
Yeah, I think you've introduced it very well, because during the Huduma litigation, this was, a very core question that we have problems with our current manual ID system, and if only we could digitize it, everything would be okay. In fact, the government went as far as saying that the current system is adulterated. That's the word they used, which is a very interesting choice of words. And that if the system is digitized and we get this Huduma number in place, then everything would be okay. I agree with Teki when she says, if the problem is discrimination or access, especially in the Kenyan context, it would be that, let me move this a bit, sorry. It would be that you need to address that discrimination. There needs to be steps taken before you roll out any digital ID exercise. If people have not had IDs for the last 50 years, for generations, they have not been able to access IDs because of their ethnic backgrounds or because of an issue such as double registration. And then you are saying that for you to be enrolled on the Huduma number or the digital ID system, you need to have the current national ID. So essentially, it would mean that a more efficient system of exclusion has just been rolled out, and even other, coping mechanisms that communities have been adopting will no longer be available. So it may actually make things worse in that sense. The other thing which I'd like to comment on is the issue of infrastructure. In Kenya, we tried to roll out a laptop project for the last, 7 years. And up to now, we've not been able to roll out this project for, among other reasons, that there is no access to electricity in many parts of this country. And there are many places in Kenya, for example, where I come from, in the northern parts, where it's easier to get network access from Somalia than to get it from Kenya. So how do you establish a digital ID system in such an environment? Essentially, you're meaning that you're establishing a system for the urban classes in Nairobi and in these other towns who have access to resources, who have access to education, who have, if illiteracy levels are 70–80%, how do you expect people to register themselves to take advantage of a lot of these platforms? But this seems to be an inevitable train that is coming. I think the way it's going across the globe, digital IDs are coming. It's important for civil society organizations to try and do as much as possible to hold government to account, to push back. Litigation is one of the ways, in order to make sure that discussions around exclusion are not just a box-ticking exercise, or or even the World Bank say just mentioning exclusion, but having no interest in engaging with governments and asking them the hard questions. Why are people from this ethnic group not being able to get on the system while others are able to get on the system? I would say that would be my long response to your question.
Thank you so much, Yusuf. Dorothy, any comments to add on this And the question was whether digital ID will solve our problems, looking specifically at pensioners in Uganda?
Oh yes, both Yusuf and Teki's response has trickled two questions that have always been running as we've been doing this work of digital ID. And one of them is what are the intentions of having a digital ID, and how digital are digital IDs, you know, in the case of Uganda. For instance, when the first time government introduced the law on digital ID, the concept then was we are trying to fight terrorism. Let's do every Ugandan and be able to fight terrorism. But then when the law was being drafted, you know, the issues of having foundational IDs then came into play, you know, having a foundation ID to be able to have every Ugandan captured into the system, right? So when the law eventually came into place, within the law, everybody is supposed to provide an ID to be able to access the right to vote, the right to the right to pension, you know, the right to social protection. All these rights were supposed to be hinged on a national ID. Then the question still remains: what are the intentions of a national a digital ID, for instance? Because if the core purpose within the law is to be able to provide government with information to plan and include everybody. Yeah, but then when it comes to practice, it's the contrary. Not everyone is included in the system. That system itself is exclusionary in nature by design, right? So then the inclusive part within the law becomes a question of whether it was the intention of government or there were other external factors that were pushing government to actually come up with a program. It was hurriedly done in the first place. The law was hurriedly passed. And then after the law was passed, there was mass enrollment that led to so many errors because the officers that were taking the enrollment had a target of numbers that they had to enroll into the system. You know, there was so much pressure in terms of the mass enrollment exercise. It led to so many errors. You can find Ugandans today who registered in 2018. Up to date, they have never received their national IDs. So they're still chasing after this ID. It means there's a cost implication, there's an exclusion implication on these particular individuals. And then the other aspect of how digital is a digital ID for Uganda. For example, the enrollment exercise, you're supposed to fill in a paper, right? And then this paper is entered by the official at the enrollment center. And then if you're lucky enough to be issued an ID, you know, an ID for that purpose, you know, you get an ID, but when you're acquiring a service, for example, in the banking sector, if you go to get a service in the banking sector, then you need to present this physical ID. There's no verification process that goes on, like a digital process that goes on to the system. It also happens with the social protection, all other users of IDs, you know, even with the education system. There isn't digital connection in terms of verification of this ID, you know. So then the question still remains, how digital is the digital ID system, you know? The design, you know, the technical failures that come with it all leave a lot to be desired. So I think governments like Uganda have to go back on a drawing board and also include the different actors to be able to identify the problem. What is the problem that we want to solve? Like Teki said, is it identifying people? If it's identifying people, why aren't we putting more effort on registration of birth rather than going ahead and putting more emphasis on registration for a national ID, for instance? You know, if we want to solve a problem of planning for people, including everybody, then if we have a functional birth registration system, it will be very easy for the national system, for the higher level, which is the functional ID system, to be able to be incorporated into the foundational ID system. But rather, you know, it beats the understanding of every actor of what the purpose of the ID system is at this point in particular point in time. Thank you.
Thank you so much, Dorothy, for those comments, because you have very nicely segued us into some of the Q&As. Pat Walsh, which I'm sure many of us, who I'm sure many of us know, asks, does a foundational national ID system provide benefits over a functional ID system? And that's to everybody on the panel. So anybody can go first.
So does the foundational national ID system provide benefits over the functional? So for the countries we looked at, I'm giggling because it is supposed to. So the idea of the foundational national ID is that, you know, it becomes the basic ID that everybody can access, because the idea of the benefits that it has is that it's easily accessible, right, to everybody. So it's an ID that everyone can have, which can then become accessible, which can then enable access to both public and private services. The idea of a foundational functional ID is that it is an ID that is issued for a specific purpose or activity. So if it's an ID that is issued for voting, then that is the purpose for which you're using it, right? If it's issued for health insurance, then that's the purpose for which you're going to use those IDs. So in terms of benefits, I think both of them provide some form of benefits, whether it's a specific or it's to enable you access some kind of services. Countries such as Ghana have, you know, had as a policy, for instance, that the national ID would be linked to other critical services. So in that case, the foundational ID was going to be linked, but that has not been successful. And it's a conversation that we've been having in Ghana for over a decade. So far across the West African countries that we looked at, it is all that the foundational ID provides is, call it a document that enables you have access to other IDs, or that facilitates, you know, so that is it has some benefit, but I think so far, based on the countries we looked at, that is the only benefit that you get from it.
Thank you, Cheki. Yusuf, foundational ID, the West African experience sounds like the Kenyan experience. The foundational ID definitely determines whether you'll have access to any other functional ID. So would you say that there are benefits of having a functional ID system over the foundational national ID system?
I think that the way we have them in Kenya is that the national ID serves as the foundational ID. But we have a couple of other ID documents, such as, you know, the driving license, the NHIF card, which is the health insurance fund card, the NSSF card, which is in case for pension purposes. So in our particular context, the two serve different purposes. And for you to get any kind of, you know, functional ID, you must have, you know, the foundational ID. It's always like a prerequisite. So the two of them are sort of in different lanes, at least from where we sit. And from the government standpoint, the first document that is required, and even from private sector standpoint, is always the foundational ID, and that's what's working. The attempts by the government to now combine all of these and create this one card called the Huduma card to be a one-stop shop. And this was one of the statements that the permanent secretary said. He said, Kenyans are tired of carrying too many cards in their wallets, and they have complained to him, and therefore he's going to bring one card with a chip in it, and this card is going to provide all the services that Kenyans need. So this would be the thinking of the government right now, that it wants to provide one card that would serve both as the foundational and also give access to all the services that one wants to acquire. I hope I have sort of, in a roundabout way, answered the question.
Yes, you have, and it still seems that the foundational card, the physical national ID, is what will determine whether you get the digital ID. So this
it does, and even the Huduma. Melissa, sorry for interrupting. Even the Huduma number card, if you see it, if you haven't been shown yours yet, it essentially looks like the ID that we have right now. So the only two things that it has is a chip, which you're not exactly sure what information is in there, and a QR code, which if you test it out, does not lead to any particular website or any, there's no information connected to it. So in that sense, it's extremely difficult for bureaucratic mandarins to move away from what they know best. So it will be interesting to see how in the coming years the Huduma system sort of blurs the lines between the two, and what it actually results in benefits in that particular format for Kenyans.
Thank you, Yusuf. Dorothy, you had already sort of answered this question before I had asked it in your last answer, but I don't know if you have comments that you'd like to add as to the foundational and functional ID systems and which has a benefit over the other?
Yes, I would like to give the Ugandan history of a functional ID. Over the years, Uganda has had a functional ID system where different access to different services have been issued with different IDs, but with the same, under the same government, but different agencies. For example, passports, voters' cards, NSSF, all these are issued by government agencies, but serving different purposes. But these same IDs, functional IDs, could be used for other services. For example, if somebody is registering for the government loan scheme, yeah. If for example they're opening up a bank account, they're interfacing with the banking institutions, they would use any of these government authorized IDs to be able to access these services. But with the coming into the national ID, which is now the foundational ID, yeah, that is used even to access these other IDs, service IDs. For example, today, a Ugandan cannot register for a passport without a national ID. It's a primary document that should be used to access national ID, or even a voter ID for that matter, you know. So the national ID is serving both as a foundational ID and a functional ID for that matter. But I would think, like I mentioned, the birth certificate would be a foundational ID for a government that wants to provide services for its people, that wants to include everybody, ensure that everybody has this birth certificate. But also the system, the other systems that can fail this, for example, in the Ugandan context and perhaps the African context, is whether healthcare services are closed to everybody. We know our communities in the countryside that do not give birth in a health facility, right? How are these going to be captured? So these systems cannot work in isolation. You know, everything has to be incorporated and work in tandem with other to be able to achieve a particular goal. So even with the registration, perhaps it may not really work out super well because of the infrastructure, health infrastructure that is not available for every person in this part of the world. Thank you.
Thank you so much, Dorothy. And yet again, you have segued us into the next question from Bronwyn. Bronwyn has asked, although the focus of the research, and I think this is in relation to Techi's report, was national IDs, The question is, if we considered birth registration or civil registration generally and how it interacts with the ID system, especially as proof of entitlement, and what are the differences between the countries in this regard? So over to you, Teki.
Okay, so we didn't consider civil registration in detail, but it definitely came up because it was almost a requirement for most to access most of the national IDs, especially the foundational ones. What we noticed, and I think it is it's an observation that we made throughout all the countries that we looked at, was that access to these IDs was extremely difficult or challenging. It's generally easy for people within the urban and peri-urban communities to have access to birth certificates and the like, but almost non-existent for people within rural communities to have access to such systems. Countries such as Ghana have had some kind of interventions from UNICEF and all of that to look at measures that can enable more enrollment, especially when it comes to birth certificates. But most of the countries are still running below. I don't think, maybe not up to, probably less than 60% of births that are of new births are registered in most of these countries. So where they're doing registration of births, which is less than 50% of the new births, and that gives you an indication. And most of these happen within the urban, the registration happens within urban and peri-urban centers. And you will realize that the challenge that this poses, especially when you're looking at inclusion, is that it further excludes the poor and the marginalized, because they are unable to, a lot of them are the ones that face challenges around providing the necessary credentials required to be able to register or access the foundational. And sometimes they just give up by not doing it, which is also interventions such as the ones we found in Nigeria and in Ghana, where in Ghana, for instance, they would allow you to come with somebody who already has a foundational ID that can vouch for you. So that makes it quite easy for you to be able to get somewhere. But from what we observed on the ground, sometimes that can also be challenging to find 2 or 3 people to assure, you know, the registration person that you are indeed a Ghanaian and you're entitled to the card can be difficult sometimes. But it's one of the easiest ways of making sure that people who do not have some of these credentials like birth certs do that. In Nigeria, some of the registration allows, I think, about 16 credentials, including even privately issued form of IDs. And so that is like a very broad spectrum of IDs. And what we then concluded was that it's very likely that most people will be able to access that. But it doesn't take out the challenge that without you know, an efficient birth registration system, you know, you again miss the mark. And that's why I keep asking, what are we giving access to? Because and I think it is known in a lot of the literature, almost everybody observes that the basic things that we should be looking at if we want to provide relevant ID systems is to look at the birth registration systems. You know, unfortunately, most of our countries are not paying a lot of attention to them. And, you know, it's very hard to understand why. A lot of lip service is paid, but not resources have not been directed to facilitate and aid these systems. All of them also talk about integration, all the IDs of the birth registration system to the national ID, but we didn't see any that has efficiently started happening just yet.
Thanks, Becky. Yusuf, the Kenyan experience as to birth certificates?
Yes. I think the question sort of provokes a legal question in my mind. There are two ways in which you can be recognized as a citizen in Kenya. You can either acquire citizenship by birth, or you can either acquire citizenship by registration. These are the two ways that are recognized by law in the Constitution. Now, becoming a citizen by registration has clear provisions. Everybody is aware of them, but there is no way in which you can prove that you are a citizen by birth in Kenya. This is because the Kenyan birth certificate, and Melissa, if you looked at your birth certificate as well, it's written at the bottom that this is not proof of nationality. That the document that is written in your birth certificate at the bottom, especially if you are above the age of 25, it says that. The newer birth certificates now, that particular clause has been removed. So that is the context in which I think, to answer that particular question, that the birth certificates have been neglected for the longest time by the Kenyan government, and have been viewed with distrust, and this has resulted in limited investment in them. And it means, for example, the place where we work in Garissa, the national average is about 60% in Kenya. In Garissa is about 30%. So half of the national average of people with birth certificates. So this essentially means that if birth certificates were to be the silver bullet, then we must invest more in them and make sure that everyone has access to them at birth. The other concern that birth certificates sort of raise is that for the time being in Kenya, they are issued either in hospitals if you are born in hospital, because you get the birth notification card, which later on you can convert into your birth certificate. But majority of people don't in this country, at least, have home births, deliveries assisted at home. And if you don't register that birth in the first 6 months, then another entire process kicks off, which is called late birth registration process, which process is complicated, very bureaucratic. You have to visit very many government offices before you get access to it. So the simple answer would be, yes, birth certificates can solve the problem if relevant investment is done and registration is able to access not only those people who are born in hospitals, but those who are born at home in far-flung areas. So that would be my response to that question.
Thanks, Yusuf. And it also begs the question why they ask us to take the birth certificate for passports if our certificate says this is not proof of citizenship in Kenya. Okay, over to you, Dorothy. Anything you'd like to add about the issue of how birth certificates interact with national ID systems?
Thank you, Melissa. I did respond to this earlier in my submission, where I gave our Ugandan experience, and listening to Yusuf, it's so similar, that our mothers don't go to hospital to give birth, and therefore that drive to encourage mothers to go to hospital would be another one, but also providing the infrastructure. I think it all goes back to the government's obligation. The government has a sole obligation of providing these systems to be able, before you actually deny people services, your citizen services, simply because they do not have a national ID, have you provided the systems that are able to capture the citizens right from birth? Yeah? Do you have the infrastructure, the healthcare that is accessible for mothers? Are you addressing issues factors that hinder mothers to go to hospital, for instance, to deliver? Is government doing its part? Is it fulfilling its social contract with the people, the citizens that it serves? So it goes back to our governments, carrying the burden, not at the end of the day, castigating individuals, its citizens, to be able to be responsible, but failing. On the other hand, government failing on its social contract. That's what I can say. Government has a key role to play here. Before we task citizens to be able to register, to ask citizens to be able to be captured in the birth registration system. Today, Uganda, under the National ID registration system, there is a program for registration of persons for birth. So the government is setting up drives in different parts of the world, of the country, to be able to capture people for birth registration. But these are just periodic drives. What happens to those that will be born after this campaign is done? Will they be captured in the system? So governments are also not just trying, with either international funding where donors are providing specific grants for registration for that particular period. What will happen? Is it sustainable? Should governments have sustainable programs that capture this, that integrate these systems into their own local structures to be able to be continuous, even when funding is done? Children that are born after are also captured and considered in order to have a running and smooth flow of the system, if we are to really have the digital ID system running. But also the issue of electricity, Yusuf mentioned it for the Kenyan example. It's the same for Uganda. How can we implement digital in a place where over 70% of the community do not have access to the national grid? How can that digital system operate? I think we need to work backwards to ensure that we capture what is important before we actually move forward with these programs that government and the international community is really pushing onto our governments. Thank you.
Thank you so much, Dorothy. And with that, we are coming to the end of this panel. I would like us to all wind up by having the panelists giving us a parting shot before I can wrap up and officially close the panel and hand over to GB. So Dorothy, okay, let me give you some breathing space. Or if you're ready, you can go first.
No worries, I'm ready. I just want to thank CIPIT for bringing us together, for setting up this conversation, and Teki for the research that they've done. It's important that this research continue to be done. I should mention Unwanted Witness is currently doing a research with the New York University and ISA to be able to look at specific exclusion factors and stories from the Social Protection Fund of government, where older persons are gaining grants, but then how does the ID system come into play on these grants? But also the health, access to health services. It's a critical area because so many poor and vulnerable communities access public health services. But then if you are a well-to-do member, you're able to access the privately owned healthcare providers who will not demand for an ID. For example, it's your wallet that speaks. But then the poor is even more victimized because they are poor. Then they have to face the wrath of an ID system and within the public health facility. So we are doing a research on that subject jointly, which I think is important for the different actors to be able to flag the different violations that happen within the digital ID system and continue to question what are the intentions? Does it serve the purpose for which it is imposed on us as Africans? Thank you.
Thank you very much, Dorothy. Yusuf, parting shot.
I'll also use this opportunity to plug my organization a bit as well in terms of what we are doing. Haki na Sheria is currently doing a research on exclusion of ethnic minorities to ID documents, Huduma. And we're happy to say that that process is ongoing. Hopefully we should have. The other thing I'd like to do is to thank CIPIT for its wonderful discussion. I have learned something about the problems that are happening in West Africa and see a lot of similarities with the challenges that we are having here in Kenya, as well as hearing from Dorothy at Unwanted Witness. They're doing some amazing work in Uganda, and we look forward to having further conversations with both CIPIT, Unwanted Witness, and the Africa Digital Rights Hub. So thank you very much for inviting me.
Thank you, Yusuf. And we've gone 360 back to Techie.
Yes, so I just want to end on the note that, I mean, this research is just a scratch on the surface. So if you look at it, we were only looking at 2 IDs, you know, but in almost all the countries, the ID ecosystem is a lot more complex than what we looked at. And I think that this should urge our governments and other CSOs to really start looking at the issues critically and holistically. Like I said, this is just a needle in the haystack in terms of the issues that pertain. And our inability to really look at the ecosystem as a whole, to address the problems holistically, is part of the challenge that we continue to face. I'm of the views that yes, IDs are relevant and can solve a significant number of problems in our countries, but clothing these issues and not necessarily bringing the issues out and understanding the basis for the kind of challenges that we are facing, I think is the bane that we are suffering from. And so most of our countries should take a sit back and really look at the civil registration system, i.e. our birth registration systems. I think if we're able to fix especially that part of the problems, we may be able to make a lot of headway, especially around, you know, access to services and provisions that are provided by government. So as a final note, I would just say that this should just be, you know, a report that is just opening us up to inquire further, to ask more questions, and to do more work in the area, which we need and continue to have to do in order to address the issues there.
Thank you so much, Techie, and thank you very much to our panelists who have been quite interactive in this session. There's so much that we have learned and I have learned personally. But the most important thing that stood out for me is that what Yusuf said, we need to be careful that we don't involve or invest in a system that becomes a more efficient method of exclusion. And that's when we are looking at digital ID. And of course, that ties up with the crux of the report by Techie and her team, which talked about access. Access is not just to the ID, but to the services and the products, public goods that the ID gives you access to. And Dorothy also said we need to ask ourselves, what is the intention of having a digital ID when we still have so many problems with the manual ID. And the accountability for all this, everybody has agreed, is a government accountability or government responsibility. So thank you so much to the panel. It has been a pleasure to moderate you. Although I really didn't have a big job to do, you did great by yourself. And I'd like to hand over now to Grace, who's the MC for this event.
Again, thank you so much to the panel, to Melissa as well for doing a really good job moderating the discussion. Thank you so much also to everybody who took time off their busy schedules to join us today. I know sometimes in Kenya, Friday is low-key weekend, and our Muslim brothers and sisters also, we understand that Friday is also the day of worship. So we really appreciate you taking your time off, and we hope that the panel provided some intellectual fellowship, or that you met somebody who's interesting, or learned something by fellowshipping with us. I am just going to post a link to the report that Teki was talking about in case you haven't seen it. Please welcome to our website and interact more with it. And anybody else who has anything else to share, please feel free to post in the chat. And with that, I hand over to Dr. Rutenberg for some closing remarks.
Thank you very much, Grace. And I'll be very brief as we're already past time. Thanks to our panelists. Fantastic discussion. I really, really appreciated hearing the perspective from across the center of Africa. We've covered parts of West Africa through Uganda and into Kenya. It's something that I think we need to do more of, and CIPIT will continue to try to hear the voices from, especially from West Africa, which, at least in my circles, I think we just don't hear enough about. So it was great to hear some of the similarities and some of the differences between our systems. Obviously, we're not trying to say one size should fit all. That is by no means true, and we don't believe it at all. But it is good to learn from others when we can do so. So thank you for all of all of you who have attended. We really appreciate your attendance on this Friday, and do follow the link which Grace has put in to see the full report. And yeah, I think I hand it back to Grace to dismiss us.